Good afternoon and welcome to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, who is our Acting Health Officer, as well as Dr. Earl Stoddard, our Assistant Chief Administrative Officer, and Sean O'Donnell from the Department of Health and Human Services. Reporters, all of you should have permission to report already. If you do not, please use the chat to request it. And with that, good afternoon to you, Mr. County Executive.
Good afternoon, and thank you everyone for joining us on our weekly press briefing. I want to start by wishing those who recognize Diwali, the Hindu New Year, Festival of Lights, a joyous week of celebration that's also celebrated by Jains and Sikhs. Yesterday, I was happy to celebrate Diwali here at the Executive Office building with our Indian community. Diwali celebrates the symbolic victory of light over darkness, good over evil, and a new year where we will continue to do what is right, equitable, and humane. And it was really nice seeing people again yesterday. It's been 2 years since we've done this. Also, I'm presenting two proclamations this morning. The first recognized the Emancipation Day in Maryland, which was Monday, November 1st. In 1864, on this day, the enslaved people in this state were freed because of a vote by Maryland residents that ended slavery. We were the first state south of the Mason-Dixon line to end slavery and to end it by a vote rather than by federal or military action. So that's not an insignificant thing. November is also Native American Heritage Month, where we recognize the history, culture of Indigenous people in this country, as well as the struggles they had and continue to have. America's treatment of Native populations continues to perpetuate the grave injustices they've endured for centuries. And I think it's important to be aware of that. It's not just a celebration of culture, but it's a recognition that some of the most fundamental things that were visited on these communities have not been made right. And we are a long way into this history. As demonstrated by the recent census, Montgomery County is one of the most diverse communities in this country, and my administration is committed to equity, engagement, and education. It's important to understand the histories and contributions to our county by everyone. And the more we know about each other, the stronger our community becomes and the greater the understanding we have of other people. In terms of case rates and the indoor mask mandate confusion, our COVID update this week, our test positivity is at 1.46%. We have a case rate of 7.26% for 7.26 cases per 100,000 residents. We had 63 cases yesterday, including 5 hospitalizations and 0 deaths. These numbers are a bit higher than where we're at last week, and we continue to hover between substantial and moderate transportation levels, according to the CDC. This hovering between moderate and substantial was expected because of the way the Board of Health regulations for indoor mask mandating were originally structured. The health officer said from the beginning that 7 days was too short a period to have confidence that we could sustain a lower rate of transmission. Our recommendation to the council on August 5th was to implement this regulation with 14 days of being in a moderate transmission level, not 7 or less, in order to avoid the yo-yoing of the regulations, which is obviously going to be frustrating to the public. I will say, though, that this is a yo-yoing about whether or not you wear a mask. In the bigger picture, the things that are open, regardless of whether it's 7 days or 14 days, remain open. So the actual activities that people can engage in really haven't changed. This is just on the masking piece of this. Throughout this pandemic, masks have been critical to minimizing COVID spread. And at this stage, because of our high vaccination rate and the use of masks, we felt confident in relaxing some of those other regulations in order to use more of our indoor spaces. With winter clearly upon us, my thermometer got pretty close to 32 yesterday, and more activities moving indoors, we do have to be aware that opportunities for COVID to spread will increase, particularly if people aren't wearing masks. Whether or not we have a mandate, wearing a mask and getting vaccinated probably remains two of the most health conscious things that you can do. I want to thank Dr. Bridgers for doing his part to do media interviews and communicate with the public why this was happening, even though these regulations were not his regulations. And I'm glad that the council addressed the problems with this indoor mask mandate yesterday. I do feel that the focus and fussing on the mask mandate are playing into the fears of extremists who are conflating good health practice with limiting their personal freedom, which I frankly think is absurd. Mandate or no mandate, let's be smart and considerate of others. The mask protects us against COVID, but also in this season, protects us against flu and the common cold. And if you and your family want to avoid sickness this fall and winter, as the governor once said, put on the damn mask. Vax rates and in the county, we are today at 77.5% of our total population fully vaccinated, and 86.2% of the total population has at least one dose. The big news today is that over 100,000 Montgomery County residents aged 5 to 11 will now be eligible to be vaccinated. It's welcome news that the CDC has approved Pfizer for children 5 to 11, and our top priority is to quickly, effectively, and equitably get as many shots in the arms of kids as possible. With 91.3% of our current eligible population, those over 12 fully vaccinated, and 99% with at least one dose, I'm confident that our 5 to 11-year-old vaccination rates will be one of the highest in the nation as well. It's evident that Montgomery County residents trust these vaccines and realize they're making a difference in keeping our rates lower. And I encourage all Montgomery County parents of 5 to 11-year-olds to let your children get vaccinated, rely on credible information and resources, and please reach out to your pediatrician and healthcare providers or to our Health and Human Services Department if you have any questions or concerns. The county will begin vaccinating children tomorrow from 4 p.m. to 6 p.m. at county-operated clinics. Friday, we'll be vaccinating from 4 p.m. to 8 p.m. The county's clinics will offer special hours for vaccinations and school-based clinics on Saturdays and Sundays. Starting at 6 p.m. tonight, we want parents to go to www.govaxmoco.com to make an appointment for their child. The vaccine will also be available at pharmacies, private physicians, and retailers such as CVS, Giant, Safeway, and Walgreens. The county's received nearly 14,000 pediatric doses from Maryland's health department for the first distribution to local health departments. The maximum weekly amount for local jurisdictions in Maryland. So we've gotten the maximum. It's important to understand that there are a lot more vaccines out in these other providers. So our 14,000 are not the total. And the state strategy does not rely entirely on the counties to do the vaccinating, but relies very heavily on private distributors and primary care physicians to get a lot of this vaccination done. Dr. Bridgers, Sean O'Donnell, and Dr. Stoddard can expound on these logistics as well as answer any questions you may have. On the quarantine in the schools, one positive impact of having our 5 to 11-year-olds vaccinated is that it will also help reduce the number of students missing class due to quarantine. On Monday, I joined Dr. McKnight and Dr. Bridgers for a press conference to update changes to our MCPS quarantine guidelines. Our goal is to alleviate quarantines and the amount of work and toll that it puts both on teachers and parents and on our folks working in the health rooms, let alone on the students themselves. So we have updated guidance. The quarantine periods and isolation periods are going down. And if your child has been fully vaccinated, they get an exposure exemption. So things are moving in the right direction. When our students returned to full-time instruction 2 months ago, it was a major milestone for 160,000 MCPS families. So many of these families had to adjust work schedules or even quit jobs to help their children with online education. And recent data shows what a lot of people have been talking about is that there was a 35 percentage point decrease in literacy readiness among second graders, a 26-point drop on math measures for fifth graders at the end of the 2021 school year, compared to the year before the pandemic in 2019. And for low-income Latino, Black, and English learners, these learning losses were even worse. As a former elementary school teacher, I understand firsthand how concerning these numbers are. This is why ensuring that our schools are safe as possible so kids are in school will continue to be a top priority. Of course, for the kids to be safe, because they're not the ones driving all over the county, it's important for their parents to be safe as well. We don't want this virus transmitting from parents to children or from children to parents. When I was with Dr. McKnight on the first day of school this year, I said that we must be prepared and honest with ourselves that this school year is going to be difficult, but we're going to make it through it by working together. And that's what we're doing. Those first couple of weeks, it was very difficult. MCPS had to, out of an abundance of caution, quarantine thousands of students per week, upsetting parents and disrupting students' education just as they had returned to school. But as each week and day has gone by, students, teachers, and principals have a better grasp of how to manage students in this environment. MCPS administrators working with our HHS department diligently worked together to find solutions and best practices and found and deployed rapid tests, and that ultimately reduced these quarantine numbers from thousands down to just 100 in only 8 weeks. It's an incredible progress. We did it by working together, not just blaming one another for making excuses. I want to thank Dr. Stoddard, Dr. Bridgers, Dr. Crowell, and our entire health department and human services teams for making the Test to Stay pilot program available and quickly contracting 75 staff members who are assigned to help designated health rooms throughout the county. We believe these new guidelines, which will go into effect next Monday, November 8th, will have a significant impact on the number of students requiring quarantine. I think this will be major progress for our students and for our teachers and provide some relief for our parents. So I'm looking forward to the 8th and where we go from there. I'm now going to turn this over to Dr. Stoddard and Dr. Bridges for updates. I look forward to your questions. Thank you.
I'll start. Thank you again, Mr. County Executive. Just a couple of points to add before Dr. Stoddard gives his update, and then we will turn it over to Mr. O'Donnell to give us a comprehensive crosswalk of our pediatric vaccination strategy, which we are eager to start conducting, in addition to Mr. Elrich's comments about our case rate and our data. Over the past 4 weeks, we've had 2,004 cases. 82 of those cases in that 4-week period resulted in hospitalizations, which is 4% of those cases. Now, when we look at the case rates by age, the case rate, hospitalization rate was lower for 0 to 9-year-old, but the case rate was high, 261 cases per 100,000. The county executive has asked us to look into this particular age group cohort to see if there are any particular cases or any outliers in the data for 0 to 5-year-olds or in elementary school settings, or any particular case rate specific to any demographic areas in the county or geographic areas in the county. And our data team is working on that now, just to provide him with that update so that he can have a more comprehensive snapshot of the hospitalization rate in this particular age category. We still see more cases per 100,000 in a race and ethnicity category in our Hispanic and non-Black population. And then lastly, when you look at those breakthrough cases, we had 867 breakthrough cases, 30 were hospitalized, and we still see the majority of those breakthrough cases by age group in our 30 to 39 age bracket, which was 165 of those cases per 100,000. I will stop now and turn it over to Dr. Stoddard for his remarks.
I actually think it's probably better for Sean to go next, since obviously the pediatric vaccinations is probably one of the more important reasons for us to be here today. So
Sounds good to me.
You're muted, Sean.
Thank you. I'm going to share my screen so I can share some of this information graphically as well. Okay, so just to update us on the timeline, we have received authorization from the FDA, from the CDC, and now from Maryland Department of Health to begin pediatric vaccinations. We're working with the state today. They've done some updates to the PrepMod appointment system, and we're creating our clinics right now for the next few days, as well as the weekend. We've learned from our state partners who is getting vaccine during wave 1 of the initial rollout. There's going to be 3 waves, and we don't yet know the specific partners who are getting it in wave 2 and wave 3, but our understanding is that health departments received it in wave 1, as well as pediatricians and family practices. Pharmacies will likely receive it in wave 2, which is ongoing right now, and shortly thereafter, any additional providers potentially will be getting vaccine through wave 3, but we're still looking for more information from our state partners on who that will be. What we've heard is that approximately 2/3 of the vaccine coming into the county in wave 1 is going out to those pediatric and family practices. So certainly we're recommending to the public, if they have pediatricians, to check with them on the availability of vaccine and appointments through them. We are also coordinating the doses that have come into the county to ensure that our minority health clinical partners have doses for the clinics that they're planning over the next week. And we'll be updating both the HHS and MCPS websites. I may have seen that some of those updates have gone live already, but they'll certainly go live today. We're coordinating content with the 2 sites. We'll have information on when, where, and how to make appointments. All the appointments that will be available will not be listed today, but by the end of today, we will have some of the appointments listed up on the website. We'll also list providers who have received vaccine through wave 1 so that the public can have a bit quicker opportunity to identify which of their pediatricians may have a vaccine that they can make appointments with. And we'll also have outreach materials that will both be going out through the public schools and through the county PIOs. And you'll see some of those in just a minute. We also have a town hall planned tomorrow with our non-public schools in the afternoon. At this point, we believe that we'll have the clinics in place and we'll be able to put appointments out to begin rolling out vaccine to the 5 to 11-year-olds in our county-based clinics tomorrow between 4 and 6 p.m. and on Friday as well. And Friday we'll begin to operate our clinic hours to a later time point, again, to give more opportunities for parents to bring their kids in at convenient times. Over the weekend, MCPS has worked very hard with us to identify locations that we could go to try to bring vaccine to more points in the county. We plan to do 6 sites on Saturday and 6 sites on Sunday between 10 and 6 p.m. And we're letting folks know that initially, because of the limited amount of vaccine that we have that's come into us, and we anticipate the demand will be much higher than that amount, we will require an appointment to ensure that we don't have to turn people away at these clinics. And our MCPS partners are working through the school system to help schedule appointments with families to fill a number of the appointments within those clinics. We'll also release appointments publicly through our website to those clinics. So in identifying where we're going to do vaccinations, we've been using an updated version of our equity strategy that we've been using from the beginning of vaccinations. We are still looking at zip codes with higher case rates. And now with the data we have over the last 10 months, we're looking at census tracts where we've had lower vaccination rates. We want to increase the vaccination opportunities to reduce racial and ethnic disparities in those vaccination rates. So we also track how our populations within the county are accessing vaccine. And we also know that there's continued disproportional impact to our racial and ethnic groups. We see higher hospitalization rates, in particular with our African-American, non-Hispanic, and our Hispanic populations. And again, it's important to try to reduce the transmission through vaccinations. We're coordinating with our transportation and other health resource partners to increase access. And of course, as we've done throughout this response, the locations will change as the data and community needs change. So what we're sharing with you today is the initial set of strategies, and then we continue to look at the data to determine where to go. So I'm going to share a different screen just for a second here. And so we just wanted to share with you graphically how we look at where the greater risk has been in the county. And much of this data is available through the Pulse report, but we look at where our case rates are higher. We also look at where our vaccination rates have been lower. And you can see that the current county clinics that we have during weekdays and weekends up until this weekend have been aligned fairly closely with where those lower vaccination rates and those higher case rates have been. As of this weekend, we went to MCPS, we shared this data with them, and we asked that they could identify sites. Again, because so much of the vaccine is going to private providers, we wanted to add an increased focus to get to our populations who are less likely to have access to these providers. And so they identified sites that could serve as clusters for all of our Title I schools and all of our focus schools. And as you can see with these blue dots, the larger blue dots, those will be the additional sites that will be operating half on Saturday and half on Sunday. Again, we're trying to make access to vaccine as easy as possible, and we'll be updating these as we go along. So just to go back here. We do have a list of the sites. Again, we'll be working with MCPS to make some of the appointments for these sites, and then we'll be listing them on the county's website, as well as doing a media push to let people know that they can make appointments as these are released. Our partners are also coordinating bus service to help families who have made appointments get from elementary schools to the middle schools where we're doing vaccinations on the weekends. And we've been coordinating with DTS to increase transportation support to our clinics. There's also a number of services that are available that can provide free or reduced costs to get to medical clinics, including Connect a Ride and the Medicaid non-emergency medical transport for those folks who are eligible for those. And then finally, to talk about the communication campaigns, our partners at the public schools have come up with some wonderful campaign ideas to both focus on the younger group that will be vaccinated, as well as the slightly older group. And these are the two campaigns that have been developed by them. The county is also going to be distributing these through our media, through various media opportunities to give folks to encourage people to come out and give them links to where to make appointments. We'll also have PSAs that are being developed in multiple languages. And again, we'll be doing grassroots efforts of community outreach throughout the rollout of this vaccine. Just to reiterate, we know that the demand will likely be greater than the available vaccine initially, but we do expect to have continued vaccine come into the county as it has in the past. And we'll continue to update the different opportunities for the community to get vaccinated as that vaccine comes in.
I think that's done for you, O'Donnell, correct? All right, Dr. Stoddard, your turn now.
All right, I'm trying to go. I'll go as quickly as I can. So I do want to share my screen. I want to share the portal, the county website at this point, just to share screen. Oh, host. I need to be able to share screen. If I can have that enabled. Well, I'll just start with the other things, and if it's enabled by the time I'm finished, I will cover it. So a couple of things. So quarantine guidelines for MCPS, I want to make sure that we clarify those. So under Dr. Bridger's leadership, we worked with MCPS to sort of take what the Maryland Department of Health and Maryland State Department of Education prepared and really make that, follow those, models that were laid out, to layer them together to make a strategy that make it possible for us to have kids be in school more, but also safe. So the major key change that was made was that if children are participating in the weekly screening program and they were wearing masks, both the infected student or staff and the exposed child were wearing a mask, they do not need to quarantine moving forward. We believe that change alone will substantially reduce the number of quarantines in our schools. It will also make the lives of our faculty and staff and parents much easier as well. That said, we were also adding a couple other things. So first off, it was in the Maryland State Department of Education and Health guidelines to include any student who has had a confirmed COVID case in the last 90 days will be treated as equal to a vaccinated student for the purposes of eliminating them from quarantine. That will require some confirmation, meaning you can't just claim that you've been exposed. You have to have a positive test that we can point to, or a physician that's willing, that will interact with our team to identify that. But obviously that is something that parents have been asking for. The final thing it does include is, again, in the state guidance, is an ability to reduce certain quarantines from 10 days to 7 days with a negative PCR test. If that PCR test sample was collected on or after day 5, then the student would be allowed to return on day 7. So that's test to return is the way that's often referred. And so that's also supported by the state guidelines. And again, that's something we adopted under Dr. Bridger's leadership. The last thing, or a couple of things. So for the face covering, the mask mandate is modified by the county council on Tuesday. Our 7-day total today is 534 cases. That is approximately 10 cases above the threshold for moderate transmission. Given the day that will come off of that 7-day rolling tracker tomorrow, if we have 98 or fewer cases tomorrow, if my math holds correct, I believe we will be in moderate transmission. So that is what we will be paying attention to. That would technically be the data that would fuel the 7th day of the requirements. The data would then be presented by the CDC the following day. So the data we have today, 63 cases, will show up on the CDC site tomorrow. That will become day 6, if based on what we see so far. So the data we get tomorrow morning will tell the story about whether we get to a 7th day of substantial transmission. And if we have 98 or fewer cases, we'll actually go back to moderate in enough time to have averted triggering that 7-day threshold set forth by the county council. The last thing I will do is I'll share our website just to show parents and those involved what we are looking at. So this page has been updated today. As you can see around the COVID-19 vaccination page, there's a tab for children 5 through 11. You click on that. There's a bunch of information here. You'll see here, this is the live link that Mr. O'Donnell referred to here that will be updated and clickable by 6 p.m. today. So you'll be able to make appointments there. The other big thing here is that you can see on the bottom of this page, there is a list of all of the community providers who received vaccinations or vaccine for this round. So if you see one of these pediatric practices as being your pediatric practice, or in some cases they'll have open clinics as well. Some of these are medical clinics, some of these are Kaiser Permanente, for example. You can certainly reach out to those that are near you and find out whether they have open availability as well. And so you can assess, what the most convenient opportunity for you and your child will be over the next several days and work with the provider that is appropriate for you to seek those. Obviously, with the fact that we're receiving approximately 1/3 of the doses coming into the county, we have prioritized, our equity framework to ensure that those who don't have ready access to a pediatrician are getting a priority for the first doses moving forward. But obviously, there is a lot of vaccine coming into the county, approximately enough doses to cover at least more than 1/3, maybe 35, 36% of the entire population in the first week. And I would expect that to expand in the weeks to come. So I will stop sharing and I will stop speaking so we can answer questions.
Thank you, Dr. Stoddard. Thank you, gentlemen. Let's get started with the Q&A portion of this presentation. And Kate Ryan, WTOP, she has a question for all of the officials. Good afternoon, Kate.
Yeah, thank you very much. And it's one of those, whoever has the answer, I'm happy to take it. Yesterday, there was discussion among council members talking about their eagerness to get their own kids vaccinated. And I think it was Council Member Albornoz said he'd already contacted a pediatrician who told him, yeah, you're going to look to some of the pharmacies because I'm probably going to get a fraction, very, very small amounts. And Mr. Albornoz expressed concern that, I'm getting a sense of deja vu, like the first days when we got vaccines and people went racing all over the place. What is your advice to people, any of you, to making sure that they can get their children vaccinated as soon as possible?
So I'll start, Kate. Good afternoon and great question. Our team has worked very diligently with our local providers and our community partners to not only identify those providers who have requested access, but also provide technical assistance to those who needed to gain access and get a PIN number so that they can get the vaccine sent to them directly to their practice. And so we know that it's a phased approach over the first 3 weeks, and that different providers have made different requests either at a higher end or a lower end, which was 300 doses during the first week. And we know that there may be some providers that received 100 doses. So we don't exactly know whether or not they received their 3-week allocation all at one time, if they're smaller providers, or if they receive it incrementally as we've done. And so we continue to work with them. So what I would say is continue to check with your providers, continue to check with the list that Dr. Stoddard provided on our website and that our team has provided. We know that we had 112 providers who in our initial survey requested or was going to request vaccines. I think 60 of them, and Mr. O'Donnell, you can correct me if I'm incorrect regarding the numbers because you've been closely tracking this on the behalf of public health. So we know that many of those providers will get vaccines and doses. So if they're comfortable with their provider and they can wait, then they should follow up. If they would rather get an appointment, as Dr. Stoddard indicated by his illustration or showing of the website, they will have access later on this afternoon. But again, as Mr. Elrich indicated, 2/3 of the pharmacies, healthcare providers, practices in the county will receive the majority of the vaccine. So this isn't like we were in the beginning of the vaccine strategy where we had phased approaches, and then within the phased approach, we had the tiering process because much of the vaccine went to pharmacies, healthcare providers, and the local health department. The game has changed somewhat. And so we ask all to check the website, to check their pediatric practices, and to look at those other spaces. Conversely, with our third shot and our booster shots, we spoke about maybe 3 weeks ago where you could go to the Montgomery County website or even the state of Maryland's website to identify vaccines. And as soon as those portals are open, there will be more places. So we encourage folks to look at those places. We have sites available. And at the request of the county executive, we have made them equitable, especially in those settings where we know school-age kids may not have a chance to get a vaccine administered in any other way. So that's pretty much the landscape that we're looking at now, Kate.
Gotcha. And then to follow up, Dr. Stoddard, you were saying, look, these will be appointment only at first, right? To make sure that people can get those vaccines, that they don't show up and are disappointed. at those same clinics, will adults be able to get a booster shot or other thing? I ask because in Prince George's County, that's how they're going to do it. That if you show up with your kid and your child gets vaccinated, you can go, hey, I need my booster, or hey, I'm getting my first shot. How will that run?
Yes, we'll have Pfizer, the adult version of the Pfizer, the 12 and up, available at these clinics, so that anybody who's eligible for a booster can get that as a booster, and a large number of our community who are looking for a second shot would also be able to get would be looking for a Pfizer shot. And again, anyone looking for a first shot, that the Pfizer 12 and above is again the most broadly utilized vaccine, because the other vaccines are only 18 and above. So we will have the 12 and above Pfizer at those clinics as well.
Got it. Thank you very much.
Thank you, Kate. A reminder to reporters, use the chat to request, to ask questions, and do mention the organization that you represent. Steve Bonnell, Bethesda Beat, good afternoon. How are you, Steve?
Doing well. Good afternoon, everyone. Dr. Bridgers, you had mentioned kind of numbers of the doses you're expecting from the state. I think it was last week. And the council members seemed to indicate yesterday that, the state's anticipating less doses than it initially thought it was going to get. Do you have any updated numbers on, the county is going to get this much and then other providers will get this much, or is that still in flux?
It's still in flux, Steve. There's been no change from what I reported last week. We know that the county received 13,200 doses, and the remaining 26,000, almost 27,000, as Mr. O'Donnell indicated, will go to those healthcare settings, pharmacies and pediatric practices. So the county got almost 40,000 doses during this first wave. And so that's pretty much has been the update thus far. We didn't receive any indication this morning. As a matter of fact, Mr. Elrich asked me to follow up after this meeting to see if we will be consistently receiving the same amount or up to our 20,000 initial ask during the first three waves. So after this meeting, I will find out and make the additional notification to our team.
And I was just comparing the sites that the county is going to run and the school sites, and it doesn't look like those changed. And even you added some additional school sites. Correct me if I'm wrong there. But I guess I think Sean said that over the weekend it's going to be 6 and 6 on Saturday, Sunday. Are those still being determined? Where I'm guessing you're varying the locations over the weekend, and just how will that work?
Yes, right now we've kind of been working with MCPS, going out to the sites, making sure that it'll logistically work with the sites. And the MCPS has been working with their principals and the other planning groups within their organization to try to reduce conflicts. A lot of our schools have weekend activities as well, so we've been working through that. And in some cases, that's why there's been some minor changes. But again, we just keep looking at how we can make this more accessible. I believe the locations I shared a little bit earlier on that PowerPoint are the ones that we are going to go forward with, and we're creating clinics for those right now.
And I imagine it sounds repetitive, but you guys are obviously going to be, it's kind of Groundhog Day with the supply and demand here. But is the hope that, in the next 2 weeks, this is really going to ramp up and Pfizer's going to get more vaccine out, just like it was in additional rounds? I mean, just what's your perspective on how that'll work, as simple as it sounds?
I mean, that's the hope. We've already, I'd say, in contrast to the initial rollout of vaccine for adults, we've already gotten a much greater amount for the population we're trying to serve. We know that we have, I would say, almost a unique demand in Montgomery County compared to the other Maryland counties. There's a lot of counties who have a very high demand for vaccine, but we've seen with the 5 to 12-year-olds that the parents are ready to have their kids vaccinated, and we believe they'll come out very quickly.
And just to give some numbers on what Sean's alluding to, when we take the 12 to 15 population, we vaccinated, I think, approximately 18 to 20% of our population the first week, and then another 30% in week 2. With this round, we actually have enough vaccine to vaccinate 35 to 40% of our population in the first week. And obviously, assuming that the same shipment comes in next week, we would be able to cover 2/3 or more of our population who is in this category with vaccine, using not just the county sites, but the whole system to do so over the same period. So I would expect that this rollout, certainly the doses should be available to move faster than we did with the 12 to 15-year-olds. But it's not, we're not going to be able to do every single person day one. It's going to take a little bit of time and more vaccine to do that.
I want to shift gears, since we're still on substantial transmission per the CDC. Can any of you just offer more clarity for myself? I've been writing that there's this lag between when the CDC kind of confirms the state and local data. When you're going through that process, I guess, what exactly are you doing? I remember a month or two ago, Saturday came out where the state reported over 500 cases, and then I asked the state the question, and it was a data error. So is that pretty much what you guys are making sure isn't happening, or is it more nuanced than that?
Sure. So I'll start, and Dr. Stoddard can jump in, because he and I have been doing the analysis along with our team and doing the comparison with CDC and looking at the numbers and looking at the lag in time and doing the calculations. So Steve, we receive the daily report usually around 7:30 in the morning from the Maryland Department of Health regarding the cases. We do our internal analysis and look at the cases, test positivities, death, hospitalization, and case rate. We then inform our data dashboard. We know that there's a lag. I think per Dr. Stoddard's calculation, 30 hours after CDC sees it. And so we've noted some data anomalies, and as you indicated, some questions in the data. And so we use that as an opportunity to do our own internal analysis, but also follow up with state to say, hey, based on our analysis, this is an inaccuracy, and what does your data say, even before we look at the CDC's data. And then we look at the CDC's data just to compare. We know they have multiple data feeds, but we want to make sure that they are reporting what they actually receive from the state or other localities. So that's pretty much it. Dr. Stoddard, if you want to add to that.
No, I think that's right. So the numbers that Dr. Bridges reported in his brief, or I mean the county executive, actually, the 63 date numbers that we saw today, 63 cases that we saw, will actually appear on the CDC page around 3 p.m. Eastern Standard Time tomorrow, meaning that we already know today, functionally because of the reporting lag, that we're going to have substantial transmission again tomorrow for the 6th day. We expect it. I mean, there could be something happens with CDC data that changes that, but that's what I expect to see. Now, by time the CDC updates for tomorrow, we will already know the case total in the morning that will appear on Friday. And so our hope is, that we continue to see a reduction. Last 4 days have been 59, 40, 43, 58, 63. So those have all been below 65. If we see another day like that tomorrow, we'll be actually be in moderate, and that would show up on Friday's CDC report. Now, the big thing to think about here is that because of that lag, it gives us that lead time, but the county council has laid out very clearly the numbers that have to be utilized as part of their amended Board of Health regulation yesterday. And so they're requiring that we use the CDC data, and they require that day one of the 7 be classified as Saturday, October the 30th. So they became increasingly prescriptive about how the data is to be read. And so we'll obviously just have to follow what their Board of Health regulation now says with regard to the calculation of the numbers.
Because the CDC has more data points than the state and local localities. Is that accurate, or did I mishear that at an earlier press conference? It's interesting, a 30-hour lag is pretty substantial, but obviously I'm wondering what information they might have that we don't have at the local level. And I know that's a technical question, but this is all very a technical process, obviously. So
yeah, so I don't actually think that there have been very rare circumstances. So one thing is, so what we see is, if you look at our case numbers, they'll actually update periodically from the state of Maryland, meaning There will be cases that are identified from previous days that for whatever reason weren't originally submitted. Like if let's say a testing vendor submits data or erroneously submits data, they'll have corrections that occur, several days later. So I think, for example, the one day I think where we had 95, I think last Friday, it was originally 94 when we first reported and actually got increased by 1 based on a reporting change that was made by the Maryland Department of Health. And so that will happen periodically. And I'm sure the same thing is happening at the CDC level where, additional provider or additional tester, maybe they didn't submit their data in a timely enough fashion and it gets missed for a day. They may recapture it on that day once it's actually submitted correctly. So that will happen periodically, but for the most part, the numbers that you see reflected on the CDC site are exactly the same numbers that Dr. Bridger reports the day before in the morning. And so that typically is literally just a 30-hour lag to show 1-for-1 data matchup. Very rarely will you see small differences of a case or 2 or 3 in those numbers. But for the most part, we know what the data tomorrow from CDC is going to say.
Right. It's interesting, Friday, I think, would be the 7 days, just following the state's numbers, not regarding all what we just talked about. That would be the 7-day if we trend in the wrong direction here in terms of being a substantial. When the mandate was put in place in August, the Board of Health met on the 5th, and then the order went into effect on August 7th. And so this new order, if it trends in the wrong direction, would be Friday would be the last day pending the CDC. You have to match all that up in the days following, but the order wouldn't go into effect until the 9th, which is 3 or 4 days. And I just wanted clarity on why this go around, that extra day or 2 was there.
So Steve, we had based on our conversations over the weekend, the county council decided to have a 7-day on ramp and a 7-day off ramp. The previous order, I wasn't involved in the discussions, but that was the council's final decision as the additional piece as far as the data projections are using the CDC data. And so the additional 4 days have been allotted to businesses to change the mandate. So once it goes in, once I send notification, then businesses will have time to reinstate the mandate. We've had conversations with our county executive. We've done this more than once, so it should be a quick turnaround, but we're affording the leeway to businesses to put the masks up, et cetera. We hope that the data, since the data is trending in the right direction, we will reset that proverbial clock. So that's the historical analysis that I'm aware of based on the case studies that we did over the weekend in providing additional guidance to council based on what we saw in the data and what the science and what the literature was saying, in addition to consultation with our public health advisory committee, which we convene just in these instances to make the interpretation, but there is no clear cookie cutter guidelines, if you will.
When Dr. Gales was health officer, he in his original notice that we had reached substantial transmission, he was the one who afforded the 4-day original time frame that for enactment of the mask mandate from the time that we reached substantial transmission in the first round. And so what council refers to the November 9th, they're simply following that same math. That said, what is actually listed in the Board of Health order is that the health officer must provide what is referred to as reasonable notice of reimplementation of the mask requirement once substantial transmission has been reached for 7 consecutive days. Now, that is not to necessarily say that Dr. Bridgers is confined to doing exactly as was done originally. He certainly could determine that because of the conditions on the ground, that it is reasonable only to provide 30 hours notice or 24 hours notice or anything along those lines, where there was as you saw yesterday with the debate that the council had, I think certainly several of the council members recognized that there could be conditions where the transmission is significantly rising, that they would not necessarily see that 4-day period as being necessary or in that case reasonable. Now, all that said, I think we are hopeful that tomorrow's case total would be low enough where it would not require that Dr. Bridger send the notice on Friday. But obviously we'll, you know, that's, you know, this has all been sort of set forth by the Board of Health Regulation, and they've clarified some of their restrictions on how Dr. Bridgers must act as the health officer with the order yesterday. But certainly the one area where they did not really further clarify is that reasonable notice period. And I think he has pretty broad discretion to define what his view of reasonable notice is, because as it is very subjective.
I also have a crystal ball too on what's going to happen. Last question here, I believe. For parents who, for whatever reason, might not feel comfortable, you know, Pfizer's the one vaccine that's gotten the green light here, but there are 2 vaccines, Moderna and J&J, that are out there too. I think it was way earlier in the year that you all said that hopefully by year's end, we'd see some movement there. But does that still hold, or does it seem like it's going to be a longer time frame there now with those 2 other vaccines?
So based on the research that I've been monitoring, it's still out. Moderna's vaccine clinical trials are still out. And so we are encouraging folks now to have their children vaccinated using the current available Pfizer vaccine that's available. We don't know what's on the horizon, as you just indicated. We don't have a crystal ball. There may be some challenges. I know that there was some challenges with the Moderna as far as myocarditis or inflammation in the heart in males, and so they're still weighing the data, and so we can't calculate that. We need to plan accordingly with the vaccines that we have and work earnestly to get those individuals vaccinated as soon as possible.
Gentlemen, sorry.
You have another question, Steve?
That's it.
Okay, thank you. Thank you so much. Next up is Randy Bass with WDVM. Good afternoon, Randy.
Good afternoon, everyone. Thanks for taking my question. Just wanted to clarify. So tonight, pediatric appointments for vaccinations through the county open at 6 on the website you all provided. When is the first appointment? When do those start? Is it tomorrow? Is it this weekend? I'm just trying to clarify that.
Yeah, so the first clinic we'll be running with the 5 to 11-year-olds will be tomorrow at between 4 and 6 o'clock.
And where is that at?
Those will be at each of our county community clinics, the East County Recreation Center, Montgomery College in Germantown, and the Silver Spring Civic Building. And again, we're going to have a limited number of appointments at that time frame.
And to how many appointments do you expect to offer in this first rollout of appointments that you're making available? How many do you think will become available?
Well, over the course of the next week, we'll use up all 13,000 doses. But for this very, very first one, because it's a limited number of hours, and because we also have other vaccines we're giving at that time, we're going to limit it probably to under 200 appointments for each of those clinics.
Thank you very much. And Mary, thank you. I'm looking at my inbox now and I am seeing that just went out. So thank you all.
Thank you, Randy. The next question comes from Anna Radelat at Bethesda Pete, and it is for the county executive. Good afternoon, Anna. Anna, Bethesda Pete, good afternoon. You might need to unmute. Okay. All right, she's not there now. That pretty much covers that. I do not see any more requests for questions from members of the media.
Hello, can you hear me?
Yes, we can, Anna. Good afternoon. You have a question for the county executive.
Oh, yes, sorry to be off message, but I'm wondering if the county executive has any reaction to a proposal that would roll back the salt cap limitations, the salt cap, basically.
I think people need to kind of tread carefully there. I'll be honest, I share Senator Sanders' concern that, this would be an enormous gift to the wealthiest people. And while we're trying to marshal and conserve resources in order to deal with other, long festering problems in this country, the loss of as much revenue as is possible could be really problematic. So I hope that if that's the path people go in, they put some limits on it. I mean, it's just, I'm not a big believer that billionaires need these kind of tax cuts, or frankly, multimillionaires.
It's not just very wealthy, but it's a lot of Montgomery County residents that have been hit by the cap who are not.
Well, that's why I said they need to be careful about where they land it. I mean, like you said, I don't have many billionaires in the county, and I don't know how many millionaires we have, but it's not an astounding number. The feds could easily target the relief to the middle class. They don't have to go to the highest reaches of this.
Well,
I mean, I've seen this should not be an all or nothing thing. Shouldn't have been an all or nothing thing the first time, and it shouldn't be an all or nothing thing now.
Okay, I appreciate it. Thank you very much.
All right, thank you very much, Anna. Good afternoon, everybody. Any more questions from members of the media? Going once, going twice? All righty then. I think we're done for today. Thank you, everybody, for joining. Have a great afternoon. Stay safe. We'll see you again soon. Bye-bye.
Bye.
Bye.